Good afternoon, everyone. My name is Deanna Fenton, Program Manager here at the Alliance, and I'd like to welcome you to today's webinar, Anatomy of a Donation Champion. We're so pleased that you could all join us as we have a wonderful presentation in store for you. Now, before we begin today's presentation, there are just a few housekeeping items that we'd like to review. For optimal visual and audio experience, it's recommended that you access these webinars using the Chrome browser. If at any point you encounter any audio issues, we recommend logging back in using Chrome. If you continue to experience issues, please dial in using the phone number provided in your confirmation email. Now, for those of you who have never joined us on this webinar platform before, please take note of the chat feature that's located in the bottom left-hand corner of your screen. This chat can be used to pose your questions to our speakers. So if you have any questions that come up during the webinar, please feel free to submit them at any time. Once the presentation is complete, we'll have some time for our presenters to address as many of your questions as time allows. Now, for those of you who may be interested in our upcoming webinars, registration is currently open for our next webinar entitled Bridging the Organ Gap, Breakthroughs in Tissue Engineering and Regenerative Medicine. That's coming your way on May 23rd at 2 p.m. Eastern. Registration is also open for our upcoming transplant webinar entitled Confronting Stigma, the Impact of Substance Use on Organ Transplantation. Be sure to tune in for that on May 28th at 3 p.m. Eastern. You can register for all these webinars and more on our website at organdonationalliance.org. For anyone seeking continuing education credits, please note we are offering one CEPC credit and one nursing contact hour for this webinar. Everyone listening to today's presentation is entitled to claim these credits. If you're listening in a group, as many of you are, please make sure to get the evaluation email from your group lead. There's a very brief online evaluation which will allow you to receive your credit. As a reminder, for nursing, you will have 14 days to claim your credits, and for CEPC, you'll have 30 calendar days. Now, at this point in time, I'd like to introduce our moderator, Mary Kay Duncan, Donation Coordinator at Life Center Organ Donor Network. Mary Kay, we're so glad that you could join us today, and at this point, I'll turn it over to you to introduce our speakers.
Thank you very much. It is my pleasure to introduce you to Robin Fox, MSN RN from Mercy West Hospital, and Reverend Paul Beckman, Staff Chaplain from Cincinnati Children's Hospital Medical Center. Robin Fox is the Hospital Donation Champion for Mercy Health West Hospital in Cincinnati, Ohio. She has served in this role for the last 10 years. During her time as the Hospital Donation Champion, she has successfully cultivated a culture of organ and tissue donation awareness with a variety of hospital and community-based initiatives. Robin has led her hospital to achieve the HRSA Workplace for Life Platinum status for 3 years in a row. Robin truly understands what it takes to initiate, develop, and maintain a robust workplace environment supportive of organ and tissue donation. Her efforts in the workplace and community have been recognized by her local OPO with the reception of the prestigious Champion for Life Award. Robin holds an MSN specializing in nursing education and has worked in the critical care environment for over 20 years. We will also be hearing from Reverend Paul Beckman, Staff Chaplain. He is a board-certified chaplain and member of the National Association of Catholic Chaplains and Pediatric Chaplains Association. He has been a chaplain at Cincinnati Children's Hospital Medical Center for 22 years with a focus on the emergency department, pediatric intensive care, Meyerson Center Child Abuse Team, and trauma services. Paul is a chaplain at Shriners Burn Hospital for Children for over 15 years and has been the Cincinnati Children's Hospital Donation Champion for more than 12 years. He also received the Life Center Donation for Life Award in 2009. Paul is also a member of the Red Cross Spiritual Disaster Team and the Southwest Ohio Critical Incident Stress Team. We are ready to get started. Robin, you can take it from here.
Hi, everyone. Welcome to today's webinar. I'm going to start with the anatomy of a donation champion. We have a few objectives we'd like to obtain today. The first one is to define the role of a donation champion in the hospital environment, recognize the impact of a strong donation champion on the organ donation process, and then finally identify some activities that promote awareness about donation within the hospital environment and our local community. So what exactly is the role of the donation champion? Typically it's a healthcare provider with a passion and energy for donation, and a critical care background is helpful. We have found that since donation occurs in most of those critical care environments, that having an educator or a manager from that environment best fulfills that role of a donation champion. A staff member is okay. They just have to be able to review data timely and feel comfortable with any follow-up as needed. The donation champion also has to be in the position to strengthen and maintain partnership between the hospital and the local OPO. It truly is a partnership, and the donation champion is that bridge between the OPO and the hospital. They also work on incorporating best practices and strategies that will maximize donation. During the donation, it's best to have the champion available, to be available to answer any questions that may come from physicians who aren't as familiar with the donation process. They also work hard at identifying and referring potential donors. Many times in my role, I'm rounding on patients in the ICU and CVU environments, especially the post-cardiac arrest patients, new admits from the ER that have met clinical trigger. I'm rounding on these patients to see if anybody has any questions and to ensure that we are identifying and referring these donors timely. Education of hospital staff is another huge part of the role of the donation champion. They work tirelessly making sure that the OPO gets that face time that is so important with staff members, whether it's clinical staff, the physicians, at competencies or staff meetings. They are that educational bridge between the staff and the OPO. And then during the donation process, they're going to facilitate optimizing organ function to make sure we're getting the maximized benefits from a donation. Many people, if they aren't involved in this process, are unfamiliar. So they're going to need help to understand that there are certain things that the OPO requires to get the best benefit out of a potential donor. And then finally, the liaison between the OPO and the nursing staff, working as in a format of team huddles. So when there has been a donor, there's the opportunity to huddle throughout the event. I have found those to be very helpful, and then to lead a debriefing post-donation to follow up on what went well, what did we do well, and what could we do better in a future donation event. So those are just some of the roles that we see have been very crucial to the donation champion. And then what's been the impact? So the donation champions, if you have a strong one, they help to embed donation into the culture. You develop this team with a purpose to give life to others. And you also help staff become more comfortable with the donation process. I found one of my biggest roles 10 years ago was helping to dispel myths about donation. Many times, I've been in critical care for 20 years, so when I stepped into this role 10 years ago, I had some night shift nurses who viewed our OPO as the vulture waiting to, take people's organs. It was a very negative attitude. So we had to work very hard to dispel these myths and to make staff more comfortable with the OPO's presence and with the donation process. And that helps with it becoming less stigmatized. And then the impact of the strong donor, as you'll see in the next few slides, is improvement in your outcomes that are measured that we know are tracked: timely referrals, vented referrals, and then the cardiac death referrals. So here's just a brief, I don't like going over data too much. I'd rather get into some of the fun stuff I have here coming up. But just to show you, I need to give you a little background. In 2014, we were the blending of two hospitals. We were two smaller community hospitals that closed and became one larger, more full-service hospital. I was a champion at one hospital. The other hospital did not really have a champion. So as you can see, in 2014, our numbers were not good. I had to work very hard to build this culture of donation. Our referral rate in 2014, overall referral rate was at 98.6%. I'm glad to say we're at 100% now. Our timely notification, I'm especially proud of this one. I don't know if somebody took an amnesia pill when we moved into the new building, but everybody forgot about the clinical triggers when we first moved in 2014. We were only at 68%. I think everybody was kind of overwhelmed with a new hospital. And these little things were slipping by. So we worked very, very hard over the last few years to get our timely referral rate back up to where it should be at 100%. Our organ conversion rate has also improved. And I think a large part of that is staff education. We have a donation binder and a checklist available on both ICU and CVU. I think they know now when there's a possible donation to utilize these resources to maximize benefits. And then our effective requester rate, we've done well with that, but a lot of the behind the scenes on that has been physician education. Another improved outcome, our timely death referral. So, calling within the hour time frame is something we've been working on. It's usually the non-critical care areas where I have the fallout. I have found that comes from maybe new staff or agency staff, not maybe familiar with the hospital process. So to help improve that, we provide a lot of education in our new hire education. And then a last slide on the data here. Our eye and tissue donors, as you can see, each year have steadily improved, and I think that goes back to our overall improvement in our timely death referrals. So now I want to get into some of the fun things, and I would say these are like my favorite things to talk about, is activities to promote donation awareness. What I would hope is you would take maybe a couple of these to incorporate in a hospital environment or the community. We've slowly added these activities throughout the years, not necessarily doing them all at once, but now we do incorporate most of these into our hospital environment, and people do embrace these activities and look forward to them. So as mentioned earlier, the HRSA campaign, Workplace Partnership for Life, was new to us a few years ago, and we were able to achieve platinum level, and I can say we are on track to get it for our 4th year in a row now. We were one of only 16 hospitals in the state of Ohio with platinum designation, and we were the only community non-transplant hospital to achieve this recognition in the Cincinnati area. And the way we came to achieve the platinum level was using a combination of initiatives through community education, the unit-based activities, and the hospital initiatives. And that's what we're going to cover over the next few slides. So one of the activities that we like to incorporate, and I'm sure many people do, celebrate National Blue-Green Day. We make it a fun event, an annual event. We like to combine it with rounding on all the units, try to get to the ERs, the OR areas, and bring a recipient. And of course, everybody likes the treats that can be handed out. But we try to make it a fun day. We've done pictures in the lobby. We've done posters where people will sign a heart and put the heart on the poster. But the staff look forward to this every year. And you can see the one year we even had the fabulous foam fingers and balloons donated to us from our local OPO, and people got a real kick out of those. Recipient rounding, that's another thing many people probably already have incorporated. I found it's best to schedule them throughout the year at different times. Nurses Week is a good time. Have people come in for staff meetings. Donate Life Month is a big time. And I like to say this creates awareness that your hard work will equal donation. This picture in particular shows one of our recent donor wives and a liver recipient. And this was actually something our staff was able to participate in because this donor came from our facility. And just seeing this wife and the recipient gave our staff a real boost, a visual that the hard work that's involved in donation does pay off. And this liver recipient here, he was just ever so grateful to the staff and the donor's wife. It really made a huge impression on the staff when they did the rounding that the hard work does pay off. Flag raising is another event we like to participate in annually in April during Donate Life Month. Our administration is very supportive. That's helpful. We get a lot of buy-in from the administration on this. One unique thing we like to do is we invite our donor families from previous years to come. We make it an environment that's healing. We like to recognize individuals that are there. And we also like to invite staff that were involved in donor cases from the past year. It's a nice way to bring people together. I like to keep it short and sweet, about 20 minutes, so that way staff from the floors can come down. We display a flag in our main lobby and then out on the flagpole itself. But kind of keeping it short and sweet, that way I feel I get better buy-in from the staff to be able to come down and participate. And I hold it in a community-like area, so that way if anybody from the community wants to participate, they're most welcome to do that. The Wall of Life, that's provided by our local OPO. We do display that at times during Donate Life Month, but I like to also say that displaying it during an off month is a good way to keep up momentum. April always has a lot of activities in it, so taking a month, maybe even like February when we have National Donor Day, is a good time to display the Wall of Life. Other things that we like to display are table tents in the cafeteria. Put those up throughout the year just to give thanks back to staff and just to show thanks to staff. And then we also like to display posters at different times through the year just to kind of keep that cultural life visual for everyone. The Honor Walk. Now this is a big one for us. We just started this last year. It was introduced to me from my local OPO. They said, hey, we'd like to try this thing called an Honor Walk. Do you think your administration would support it? I said, yeah, I do. I think this would be a nice way to show respect to the yes that a donor and a family have said. So this picture here, I know many people have probably seen it. This was at our facility. I was standing right there next to the donor's wife when she wanted to pause for a moment to take this picture. We had probably 150 to 200 people there for this first Honor Walk. The gentleman was just so well known throughout the community, and staff really grasped onto this. They wanted to be able to provide a respectful and compassionate way to help support this donor family. And what I have found doing these, it's just as much for the staff as the family. So many people feel that they can't fix this for the family, but they can at least be there to support them. We've done them for brain death and DCD. The DCDs that I've done it for have gone on to donation, but I thought to myself, why not give them the opportunity to have an honor walk, because they are saying yes, and the families were most appreciative of that. Another thing I found important with doing honor walks is to have a point person for coordination. That's crucial. So you need somebody that's going to be the one that's kind of bringing the family together and bringing the staff together. We usually assign someone to family and the participants in the walk, and then we also assign somebody to the staff members that are along the route. It's also good to practice the route beforehand just to make sure the doors and elevators and everything open the way you want them to. And then we have found that it's nice to end the honor walk with a prayer or some appreciations. It's just a nice way to kind of wrap it up for the donor family. A few other little notes on the honor walk. The honor walk is 100% voluntary. When we approach a family and we offer this, it's voluntary. But we have found people just embrace this. That walk to the OR is very lonely. And having this hallway full of support, it's very comforting to them. Most of my honor walks have occurred on holidays and nights. And if you work in a hospital environment, that's when staff is most strapped. But I will tell you, I am extremely proud of my staff. They have showed up. They have stood up. They have been there. 9 p.m. was one of our honor walks. That's during a heavy med pass time. And they took the time out to come down, to stand there 15, 20 minutes to support this family. And the family will just say, I knew the community and my family members were going to be here. I had no idea this much staff would be there. It's very powerful to them. Many people ask about, do I need to say or do anything? No, you're just being present. You're being there, and it's just a respectful and powerful and healing for them. Confidentiality, many people ask about, is there some type of consent form for families? And Life Center has put some type of consent form which they review in detail, and they understand that there is a possibility for a breach of confidentiality, just like any time a patient goes to x-ray or a CAT scan, when you could pass your neighbor in a hallway. So this donor, when it goes down the hallway, there's a chance somebody might recognize them, but that's a chance that could always be present. And then staff, you participate willingly, so there is no consent necessary for staff. And again, we make family the core of this process. People call it an opportunity, a sacred moment, a divine appointment to be there with them at a time when the support of their community and family is so important. Word clouds is something else we incorporated in the last year or so in our donation process. And this came from a journal club review that our unit did, and I'm just so pleased with this. The word cloud has turned out to be just phenomenal for our donor families and for the staff caring for the donor. So if you're not familiar with a word cloud, it's a picture of words. You can go to a variety of different websites. They're also referred to as wordles. And what I like to do is during the donor cases, there's usually that period of waiting to know, when are they going to go to donation. So that's when I like to introduce this. And the purpose of this is for families to connect with the staff and to reminisce. So you ask them to give you words that describe their loved one. I have a little template they fill out, and it's just totally a nurse-driven process. It allows the nurse to connect with the family. And during one of ours, I like to share this story, one of the first word clouds we did, it was with that previous wife, the donor that we also did the honor walk with. We were in this waiting period, and it was, going over a few hours. The room was packed. We had so many people. We had to relocate many of the family members down to the main lobby. So I decided we need to introduce the word cloud to them. So I brought in a piece of paper, and I said, while we're in this waiting period, I'd like for you to share with me words that you would use to describe your loved one. And the father got all teary-eyed, and he looked at me and he said, I know the perfect word. I know the perfect word for my son. He's my hero. And he got teary-eyed. He goes, he's my hero. And then the wife of the donor, she began to cry pretty hard. I thought maybe she was taking the process, not so well. And I said, and then she looked at me and she says, I hate to say this, but the first word I thought of was stubborn. She goes, I feel a little guilty about this, but I thought of him as being stubborn. And I assured her that there was nothing right or wrong with this, that, stubborn can be a good quality. It's perseverance. So, it was a great time to bond and talk, and we had pages of words, and it was just really neat because, we didn't know this other side of the donor. And I have found these word clouds just to really blossom and just be just a huge source of comfort for family and the nursing staff. We like to, at the end, once the word cloud is created, we like to print it in color, and then we put it in a picture frame. You can get picture frames relatively cheap, and we present that to them as a gift from our unit to them, and it's been very powerful. Community education, that was a huge part of our HRSA campaign. We looked for, where do we see a disconnect, or where do we see an opportunity to provide education? And one of the nurses on the staff, an ICU staff, has a father who is a fire captain. And she said, let me check with my father. And he said, we really don't know much about tissue and organ donation. Let's start with some basic education. They were excited, to say the least. They were just pleased that we would take the time. I used my role as the liaison between the OPO and the fire and EMS, and we set up multiple educational sessions. And then as we started to dig a little deeper into this, we realized that there was a potential to refer from the field. So because of our efforts, we now have 3 departments using their current technology. They use something called a safety pad to refer in people who've passed away at home for potential tissue and eye. And it's really starting to take off. We have found that this area is an initiative that's going to continue to grow. And then some final thoughts on donation. I like to say select your champion carefully. You want somebody that's positive, energetic, knowledgeable, and has a passion for donation. Of course, you don't want somebody that's going to have be unsure or unavailable or negative. And then a thing that we like to do is develop some unit. We call them donation experts. I had a few of my staff complete a PowerPoint and quiz provided by our OPO Life Center, and they became my donation experts. So when I'm not there, they can fill in the role of being the facilitator. And then I like to reward them at the end of the year by taking these donation experts to our local OPO activities like our community breakfast and our fundraising gala as a way to say thank you for putting in this extra time. This picture shows a couple of my donation experts who have put in a lot of hard work to keep that spirit up on the unit and to make it exciting and purposeful, to make connections that referrals and donations equals life. And just want to say thank you. I'd like to end with 6 or 7 years ago when I went to our local community breakfast. It was just me and my nursing manager sitting there in a sea of people from all these other hospitals, and we looked around, and we were the only ones from our health system there. Now we are able to fill 2 tables with 20 people. We get excellent support from our local hospital, and this fire that we have started at Mercy West is spreading to our sister hospitals. And I can say in Southwest Ohio, we are building this culture of donation and donate to life. And it's coming from our little group that we started with a few years ago, is really blossoming now. And this just shows a group of us that went to a community breakfast. So I think this it can continue to grow. Just with starting with a few people, it can grow into something great. So I want to thank you for my time here with you. I'm going to turn this over now to Paul Beckman, the chaplain from Children's Hospital here in Cincinnati. He's going to share with you his experiences with donations. Here you go, Paul.
Thank you, Robin. What a great synopsis of a great program that has just blossomed in the last 4 years or 3 years. So I'm going to continue with Robin's presentation and talk a little bit about what Children's Hospital Medical Center does. And there's a picture of children's. And I will answer the question that's probably coming up in some of your minds is, what is a chaplain doing in such perhaps a clinical environment? And I will get to the answer to that coming up. But that's children's right there. And here's a couple of statistics on children's. We have 700 registered beds. That sounds like a lot. There's probably close to 100 psych mental health beds involved in that. We have 32,000 plus admissions, 173,000 emergency urgent care visits, 1,281,000 patient encounters. We are the only pediatric level 1 trauma center in what we call our tri-state. We are surrounded by them up in Columbus, Indianapolis, and down in Louisville and Lexington, but we're the only game in town for pediatrics, so to speak. We are a transplant center for heart, liver, kidney, lung, and small bowel. We have 83 ICU beds, with 35 of them being the pediatric intensive care. Children's, in effect, has a whole bunch of donation champions since they are a transplant center. Two identified are myself and then one of our intensivists in the pediatric intensive care MDs. But I consider, since we are a donation center, that we have many. And we have a donation committee, which is comprised of a Life Center, which is the name of the OPO that I'm presenting from. We have transplant surgeons and the different organ teams. We have the Heart Institute, the NICU, and the PICU representatives. We have transplant coordinators and administrators and project managers. And we have chaplain, and that is not just me, but the entire Department of Pastoral Care. And we meet quarterly, and our OPO representative to our hospital structures and facilitates these meetings. And so I would consider every person that is in those meetings as champion for donation. Just a couple of quick statistics. I'm not a statistics person, so I will go over these. We talked about timely death referral rates. In 2018, we're at 98%, and as Robin said, much of that is around physician education because they are usually the ones who will initiate a call when a patient has met certain triggers, and so the more you educate them, the better. And just also, we are a teaching hospital, so there are new residents and fellows coming in every June and July, and so that education is very important to keep these numbers up. Our 2018, we had 111 vented referrals, 93 tissue referrals. This chart, graph, you probably can't see it very well, but there's a story and a background behind this, and I want to take a little bit of time to explain that because it exemplifies collaboration. But basically this shows, and I'm going to move to the next slide so you can read it better, that in 2017, here were our tissue and eye numbers, percentages, and in 2018, our tissue went up by 5 and our eye went up by 16 significantly. So now the story behind that. For my 20 years or so at Children's Hospital, when we had any meetings or negotiations or talks with the OPO Life Center was very gracious to allow pastoral care, the chaplains, to request for tissue and organ on site. Not organ, sorry, tissue and eye on site, not organ. So when we met this collaboration, we were trained yearly by the OPO, and it did very well. But as the years went on, and I do mean years, 10 plus years, we at one of these donation committee meetings were looked at figures that showed that the numbers were down a little bit. And so we had a few meetings, and we decided that the Life Center, the OPO, would take back the tissue and eye, and because, and the basis of that is that they do it all the time, and pastoral care, even though they have a deep connection to the family, do not do it day in and day out. And so we made that transition, and fortunately, we are going up, and that's what everybody wanted. So we see that as a wonderful example of collaboration. I think the Children's Hospital part of it and our people involved felt very close to our families, and we weren't sure at our hospital how someone making a call that has never met the family would do. And so it took us a few years to let go of that and realize that the professionals, the very compassionate people that do make those phone calls, actually made an increase. And this brings me to a little graphic that I like to talk about. And we have the OPO, Life Center, we have the hospital, and we have the parent. I was thinking after I did this, you could actually put a fourth person in there, and that would be the coroner or the medical examiner of the county, because more cases are coroner's referrals, and they have to have input into donation. And I'm happy to say that our current coroner has been very compassionate, very willing to listen, and very supportive of organ and tissue donation. But this middle center, the darkest green center, I like to call the sweet spot, because it is the collaboration of the OPO and the hospital, and then moving to the parent, and that center part represents the relationship between all three dynamics in donation. Robin referred to this huddle. As far as collaboration, the huddle is probably one of the best ways to become a collaborative team. Earlier on, we had some issues, like Robin's hospital did, about what's Life Center doing here. They come so early. They're kind of not part of the team, and I'll talk to you about that at the next slide. But the huddle is the gathering of important staff to discuss and strategize the medical assessment of the patient and the parent-family dynamics to optimize the care and approach for donation. Just an example of a few people that would be there would be the Life Center personnel, the MDs of usually the critical care unit, perhaps a referral MD from a different division of the hospital, the bedside RN, and probably the charge nurse too, and then the chaplain or social worker, who is the supportive presence for the family. Pediatrics and donation. I wanted to just touch on the uniqueness of pediatric donation. I know when firehouses run, they say that maybe 7 to 10% of their yearly runs are for pediatrics. And so I just wanted to touch on some of the variables that very briefly that might be involved in pediatrics. There are common denominators with adult facilities, but there are individual numerators, I believe. The first one is, in a pediatric center, you're dealing with infants, toddlers, children, preteens, and young teens. Most of them, or many of them, not having a driver's license, not having any designation where an OPO or even a family could say, yes, on that license, he said that. And so how do you talk about that without just a clear-cut sign that this person wanted or was interested in donation? That's one aspect. Another variable would be a parent protective mode may come into play. And I like to describe that parent protective mode as the parents sit helplessly with their infant, toddler, or child. Often in a big, complex medical system, they cannot do anything, and so they feel very helpless. And they feel like often they have let their child down, that they weren't there to protect their child. They have failed in that protection. And so some may move into this parent protection mode that they don't want anything else done and to their child. And so this is one aspect that we need to be aware of when we're working with families as an OPO and as a champion and a staff. An overwhelming grief, the loss of many things, not just the loved one, but perhaps of future events and dreams, can be very overwhelming for parents as an OPO and a provider goes in to talk to them. It may help to ask parents about the personality or the spirit of their child. Robin talked a little bit about this with her word cloud, and that's a wonderful idea. I hope you don't mind if we copy that, because I like it very much. But in the telling of the stories and in the what kind of a child, what kind of spirit, what was he like, it often begins to make the parents realize that their child was a giver, their child was a helper, and they can, in their mind, amongst all of this overwhelming anguish and emotion, begin to move down that path. And the stories that are also told are very healing and very helpful in the process. Some of the cultural changes that I have seen, again, many moons and a lot of water under the bridge, is that our OPO Life Center has specifically told me that they have gone from feeling like outsiders as they enter the hospital to teammates. And that just doesn't happen overnight. That is a consistent, intentional effort on the part of not only the great people at the OPO, being very friendly and compassionate and skilled, but it's also the donation champions to create that environment and to welcome the OPO in. I've noticed that hospital staff have gone from, oh, there's nothing that they can donate, to, I was really surprised that they could donate something. Doctors have said that, many specialty doctors like the oncologists and that will say, oh, chaplain, or oh, there's really nothing. And I'll say, well, let's wait and let the OPO tell us that. And then the other part of that is, oh, no, they won't donate. I've worked with this family a long time, to, I can't believe they donated, and it's a celebration for not only the family, but for staff as well. I found that parents and families are beginning to initiate the questions about donation and bring it up themselves. Someone in the family, maybe a parent or maybe a medical person in the family, and then the education of the staff response to that, to allow the staff not to get too deep into that, but to do what a great referral is when you have JACO come. I might not know the answer to that, but I know where I can find that out. And then get on the phone with the OPO and say, the family brought up these questions, and can you bring somebody over as soon as you can? And then the last one, the cultural change, I've noticed staff energy and enthusiasm around patient and parent stories. So being a transplant hospital, we not only have donors, but we can and often do have the recipients in the next pod or in the same pod. And so that creates a lot of dynamics there. But it does, I think, help the staff. It gives them very much concrete visuals of if the organ comes or the tissue come back to that same hospital in a patient that's also on our unit. It really just shows the heart and soul of this donation of death and then life, and how it's difficult to hold both the grief of the donor family and the joy of the recipient family, but it can be done, and we nurture staff with that. Some of the fun activities Robin was referring to, I think we have many of the same things, the Blue-Green Day, the roundings, the recipient roundings. The roundings by Life Center, I will talk about that in a minute at the bottom of the list. The flag-raising ceremony at Children's Arts is a little more elaborate than 15 or 20 minutes. I'm not sure that's a good thing or a bad thing. Maybe it just is. We certainly do not get as many clinical people down there for an hour and 15 minutes, but I think it is wonderful because we pull in community people, many figures in the community that are well known politically or on the news or something like that. So maybe it just has to be that way because it's a transplant center. Education, I think, is always important. We are, as I mentioned, a teaching hospital, so that is a huge part of it. Debriefings and diffusing. At Children's, the pastoral care department debriefs and diffuses at all deaths, but when there is donation involved, it is an added ingredient to that diffusing. Bereavement support follow-up. We have a bereavement department that staff know that we'll be contacting the family and following up with the family, and that's helpful. And sometimes without breaching confidentiality, stories can get back to the staff about how the family was doing. And then probably, at least for me, in my practice in pastoral care, and I think in almost a lot of things in healthcare, visibility and availability are the utmost importance. The visibility, very strong from Life Center up at the hospitals, walking around, greeting, shaking people's hands, talking about any questions that can come up with donation. And, of course, the pens and the different things are always accepted. And the availability that Life Center has and that donation chair, like donation champions like Robin has to their staff is huge. I could be the greatest chaplain in the world, but if I am in my office on my computer and that office is 2 buildings away or in our case across the street, I might as well be in a different county or a different state. But if I am available and walking through, people see that I am there, and if it's a donation case, they may say, you know, how does this work? I had somebody, and for a very basic question for me, I had somebody say, can you donate if it's a coroner's jurisdiction? And I was able to spend a couple minutes and talk to them, whereas if I was on my computer or something in my office, that moment would have passed. A couple of pictures to near the end. This is during April Donate Life Month. Some of our transplant team members outside our cafeteria. This was a Jeopardy. I didn't make it to that, but apparently this is some of our MDs and APNs that had a Jeopardy donation game. And there's some more of those phone number 1 hands. And then this is our flag raising ceremony. And, you know, right there the flag that hangs there, it was a representation that this hospital, but more importantly, the people in it, value donation and will do everything possible to for the donor and the recipient family. Some of our future goals that are looking at is a donor memorial, which is actually would be carved out. We've had thinkings of like a garden or a wall outside, something very creative. And as you know, if you work in a hospital or enter it, space is so much of a challenge to get. So that's something that I hope will come up. Continued community connections. We had a community connection with Miami University, and then just the current process and initiate programs that will help. And this last picture I just threw in there, if you can't see it, it is a airplane somewhere in Africa, and there is a pride of lions lying there under the only shade in about 2 or 3 miles. And I just use it because it kind of shows that the OPO and the hospital and the family can come together find the best way to be in relationship with a family and make donation happen.
All right. Thank you, Robin and Paul, for such a great overview of the role of a donation champion. Before I turn it back to Mary Kay for questions, I'd just like to remind everyone that if you do have any questions to ask our presenters, please submit them using that chat feature. Again, that's located in the bottom left-hand corner of your screen. Also, during the Q&A session, I will have this poll up. For those of you who are listening in a group, if you could please just complete this poll and let us know how many people are actively participating in your group, that would be greatly appreciated. That being said, at this point, I'll turn it back to Mary Kay to moderate your questions. Thank you.
Thank you very much. I think we're going to start with a question for Robin. How did you get your staff to embrace the culture supportive of organ and tissue donation?
I think one of the things I did to get staff to support this culture, like I mentioned, it was difficult years ago when I first took the donation champion role. There was a lot of myths and misconceptions, and I found one of the best ways to develop this culture was to first break down those barriers with the myths and misconceptions through a lot of formal education, and then informal education. That's staff meetings, Life Center, the liaison I had at that time was very open and available. As Paul said, availability is huge when it comes to this role, and was able to meet with staff at their level. What is that you're fearful of? What can I help clear up for you? And then slowly, each year, I just kept adding these little bits of activities in there. And then now it's just part of it's just who we are. It's what we do. We have that fire in our belly when it comes to donation. But it didn't happen overnight. It has taken some time. But just starting by dispelling some myths and misconceptions with the staff.
Thank you very much. Paul, how might you keep up the momentum? Robin touched on this a little bit, but things that you have done to keep up the momentum of donation awareness after Donate Life Month.
Well, when I came in here, I saw a lot of people who had exhaled from the April donation month and all the activities. But I know that those people will be, after they take a breath, will be back at it. And as Robin said, that wall of donors is very helpful to have. Visible things around the hospital, the hospital liaison from the OPO coming and being at those rounds weekly or monthly is very helpful. For the donation champion to be out on the floor, everything from the pins that we wear or the lanyards that we wear to signify life, which can prompt someone to ask about it, staff member or family. It might give them an idea. So it's not just in April, but I think throughout the year to find these ways to keep it visible.
Thank you very much. And Robin, I'm going to give this next one to you. What is the process of informing staff of the honor walk? Do you announce it overhead, or do you call each unit? Have you figured out a method that works best?
So for the honor walk, the notification of staff is going to be dependent on your facility resources. So at our facility, we have a texting system through our phones that we carry. And so, donation, the time of donation is, let's say it's finalized for 9 p.m. So, many times you may only have an hour or so once that donation time is finalized to spread that word that, we're going to do this honor walk at 8:50 p.m. The donation time is 9. So what we found at our facility was we used our texting system, sent out a mass text to all the units, and then we utilized our nursing supervisor to also spread the word through rounding on the units. We also have utilized our email system, but I think it's going to be dependent on what what you have available at your facility to get the best response for the honor walk. And like I said, all the honor walks that I've done have been at nighttime. We even did one at like 4 a.m. So announcing overhead was not really an option. So going through the grassroots really and just talking it up. And like I said, my night shift group at Mercy West is just fabulous. They have been ever so supportive of the honor walk process, and they actually look forward to the next one.
I wanted to add something, Robin. Perhaps it's a lesson learned. One of our honor walks was forming, and so was the OR team to take the deceased down. And so we got the word out there a little early, or we got informed that they would be going a little sooner to the OR. And what I mean by that is like 10 minutes. And so the line formed for the walk, and then the OR team was still in the deceased room discussing things, and 5 minutes went by and 10 minutes went by, and we began to lose some of the people from the honor walk. So what would have started with maybe 40 people, by the time we actually came out of the room was down to like 20, and that was a little sad for me, but just keep that in mind.
Yep.
Thank you both. Paul, I'm going to give this one to you. Is there any perceived conflict of interest having your transplant involved with the organ donation efforts? I'm assuming this is based on the picture of the donation table.
Which picture?
Of the transplant teams who are working the donation table outside of the cafeteria.
Oh, yeah. I'm not sure. My mind went somewhere else with that, of just the potential of having recipients and donors. But if that's what you're referring to, the donor committee, donation committee, does have some of the surgeons on it behind the scenes. But when there's actually a donation, the people that are engaging with the family are the Life Center OPO and the doctors on the unit, the intensivists. That the surgeons do not get involved in that. And as far as the picture, I'm not really sure if there is an ethical dilemma if you have some of your kidney or heart teams down there promoting Life Center and organ donation. I hope that answers your question.
And to finish Paul's statement, I believe as far as the staff working the table, I believe it's truly just an awareness, which I think is something staff speak to families about anyway. They are definitely not any part of the donation process in any way, shape, or form. And that will slide us right into this next question. In a transplant center, how do you best maintain confidentiality during the walk of honor when the donor and recipient may be in the same ICU or, like you stated, the same pod, et cetera?
Yeah. I think there would probably be an effort not to have them in the same pod by the charge nurse, and that would be my first take on it, that they may be in the same unit but not on the in the same pod. There would be an intentional effort by the OPO and the hospital staff in the ICU to, first of all, not let the families, as the process goes on, really be able to talk too much. But in social media, this day and age, we have had situations where somebody might say, "Oh, I heard about this, girl who needs a liver," and it can get pretty sticky, and that's why we, with our OPO and the hospital staff, use the huddle to very much take a look at confidentiality and the issues that could come up when you have a donor and a recipient in the same unit of the same hospital. As far as the walk is concerned, we would most likely have them either in a part of the hospital, maybe outside of the immediate ICU pods, or we would make sure in some way in our planning that a family would not be walking by and bump into that. It is a concern, though.
Thank you very much. And you did touch on that it definitely has to be a thoughtful process, so everyone is taken into account. Well, I'd like to thank you both. I think we're at the end of our time.
Thank you, Mary Kay.
Thank you.
Yes, once again, we'd just like to extend our sincere thanks on behalf of the Alliance to Robin and Paul, as well as Mary Kay, for your time and for sharing your expertise on this topic. So thank you for that. And to all of our participants, as always, we thank you for your time as well, and we wish you a wonderful rest of your day.